I have used them for earplugs before. Like
You use them as earplugs?
Yeah, stuff it in there.
Oh, wow.
Yeah.
Oh my God. Are they effective?
What?
Are they
Huh? I'm Ellie Gunther. I'm 28 years old, and I hate my ears. I had plugs in my ears for 5 years. So when I started stretching my ears, I had only planned on going to the size of a cigarette. But when I reached that size, I decided this wasn't enough for me. I needed bigger ones until I got to 3 inches.
This is called ear gauging, where you start off with a small piercing of the ear and you put gradually larger and larger gauges into it to stretch out that earlobe. It's quite often one of the first steps that young people take when they're trying to modify their bodies.
This is the last pair I ever had, and they are 3 inches in diameter. After they broke, it looks like fish bait hanging off my head, so I'd like to do something about it.
As that earlobe gets stretched wider and wider and wider, you have to expect that that skin is going to get thinner and thinner and thinner. And like what happened to him here, at some point, if you've got a heavy earring in there, it could just snap.
I feel like I've matured. I'm in another phase of my life, almost 30, so I need to look the part and be the part so I can look more professional at work. I do construction, and dealing with homeowners, it's obvious that they're noticing my ears before they're even paying attention to what I'm saying.
So obviously his appearance should not impact whether he can do this work well or not. But perceptions are often what people consider reality. I will occasionally have people come to my office who want to treat their gauged ears because they want to, let's say, have a more professional job, and they believe that by having these ears that look different than everybody else's, that they may not have as good of a shot at getting that job that they want. So his is a story that is definitely not unusual, although his earlobes definitely are not what you usually see.
This one broke naturally, and my other ear, I actually got into a fight. It was just some guy kept getting thrown out of bars and stuff, picking fights with a bunch of people, and then he tried to pick a fight with me, and I gave him a good one. And like whenever he fell down, he grabbed my ear.
I
and
see.
I don't know if he did it intentionally or just instinctively reached out and grabbed it, but he latched onto it and ripped it out.
Now the big question here is how long has he gone with his earlobes just dangling like that? I think it would get annoying after a while if you'd feel that skin just kind of hanging there, or maybe he just like plays around with it like some people play with their long hair.
Have you ever tried to do anything to them yourself?
I have used them for earplugs before. Like
You use them as earplugs?
Yeah, stuff it in there.
Oh, wow.
Yeah.
Oh my God. Are they effective?
What?
Are they
Huh?
I bet you those actually work because they're soft. You could probably compress them. You could roll it up and then stick it into your ear.
What is your ideal earlobe?
I don't know. Maybe George Clooney's got some nice ears, right?
George Clooney's ear? I have to look those up.
George Clooney's got some pretty nice ears, so I can go with that.
Can you name a celebrity whose earlobes you really, really like? I mean, probably not, because usually the only time we look at earlobes on somebody is when they've got really nice earrings. And usually those earrings are covering up the lobes anyway. Now, it's not uncommon to undergo cosmetic earlobe surgery when you've got a tear in a normal piercing. That's something that we do all the time. And it's much, much easier than fixing what he has had done.
What's challenging is we have to make sure your earlobes match. So this ear is a little bit more challenging than that ear, just because you have a little bit more tissue on this ear. What I'm concerned about is the smaller part of your earlobe. It's all been stretched and distorted.
Some operations that we do in plastic surgery are called cookie cutter operations, where you basically have a template that you can apply for the operation, and you kind of do the same thing on everybody. When you're fixing a torn gauged ear, there is no template for that, especially somebody like him where there's so much extra skin just hanging there. This truly is where the artistry of plastic surgery has to come in, because you have to create a new earlobe from something that is very different each time. This episode is brought to you by my skincare line, Youn Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryounonline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video.
For Elliot's earlobe reconstruction, I will remove the excess earlobe and reconstruct the remaining pieces to look more normal. You're gonna feel a little poke, okay?
Okay.
This is the part I'm really numbing you.
This is being done under a local anesthetic. So you inject a local anesthetic into the area. Because it's a small area, there's no reason to really do this under a general or even a sedation. Usually people tolerate this procedure very, very well.
So this is really the part where you wanna measure 20 times and cut once, because once I cut off your earlobe, reattaching it would be a different story. Do you feel anything?
Not yet.
So we're just removing the skin on the edges of the earlobe so we can re-sew them together. I think I like it like this. I think that looks good. It gives it a nice curve.
That is exactly how I would do the operation. The idea is that you take some of these raw edges, you try to put some of it together, you kind of tack it together to see how it looks, and before you make your final cuts, you want to make sure that things look like they're going to fit the way you want them to. The worst case scenario is that you cut too much out and you go, oh crap, I needed that skin that I just cut off. What am I going to do now?
So after we do this, there's really no going back. Your earlobe is off. Okay, right here. So basically, contouring, we're just trimming the extra pieces, looking at the shape, trimming more, looking at the shape. And this is where the art of plastic surgery comes in that, anyone can sew everything together, but you want to make sure it comes together beautifully.
Now you may have noticed that she was cutting the skin over a wooden tongue depressor. Why was she doing that? Well, the answer is she doesn't want to cut it over her finger because she might cut through the skin and actually cut her own finger. The sign of a not so good plastic surgeon is one that cuts themselves while they're operating on you. And I once heard a story about a surgeon who actually was injecting a patient with anesthetic while that patient was asleep and actually stuck the needle into his own hand and had no idea because his diabetes was so bad he couldn't actually feel his hands. Can you imagine?
I don't know. Do you feel like they're the same? This is George Clooney on the table. It looks exactly the same.
My God.
I often hang goal photographs in the operating room of the result that somebody is looking for surgery. So for example, if I'm doing a breast enhancement and somebody brings a photo of a social media influencer in a bikini and they say, hey, I want my size to look kind of similar to that, then we can use these goal photos as a guideline of how to create what the patient wants. But in all my years of fixing earlobes, I've never had somebody bring a picture of a celebrity's earlobe that they wanted to look like.
All right, so I'm done with your right ear. Now we're ready to move on to the more difficult ear. You have the longer piece. First, we're just gonna remove the extra earlobe. We'll make the incisions. All right, here it goes.
Okay, is it me or did it look like an actual finger that they put on that Mayo stand that she cut off? Or does it look like another part of the body?
Hi guys, how are you? How are you doing?
Doing
Good
great.
to see you. Let me take a look at you. Oh wow, you look great.
Yeah,
How
how are you?
was it after?
Awesome. Yeah, it hasn't hurt at all. Been fine. Before, my ears were droopy and embarrassing, and people stared at me all the time. Now I'm starting about my ears. They're not slapping my neck anymore. Having them in one piece again. People don't look at me strange, point me in grocery lines, and it reminds me of having ears like I had when I was a kid. That's awesome.
She did a wonderful job, and it's just an example, like you see on Dr. Pimple Popper's show, where making these relatively small changes in a person's appearance can really make profound changes in their lives. Speaking of Dr. Pimple Popper, if you enjoy watching her show, you're going to love my reactions to her videos on this playlist right here. Some of these are absolutely fascinating. And if you've been enjoying my videos, please subscribe to my channel. And always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.